Hello, my name is Rachel Stodel, a dietetic student in the coordinated program at Eastern Michigan University. I'm here to break down the nutrition-focused physical exam to help you feel more comfortable and confident. To begin, let's discuss what the nutrition-focused physical exam is. According to the Academy of Nutrition and Dietetics, this exam is conducted by registered dietitians to assess nutritional status or evaluate for malnutrition. To further explain, this is a head-to-toe exam looking for subcutaneous fat loss, muscle wasting, and signs of micronutrient deficiencies. Upon entering the room, introduce yourself and explain the purpose of the exam. This helps the patient feel more comfortable, especially since it's a hands-on exam. Once the patient agrees, prepare yourself by washing your hands. Wash your hands for 20 seconds with warm water and soap. Dry your hands well and glove up. Since this is a head-to-toe exam, we'll start with the head and work our way down the body. With the hair, ask, have you experienced any changes recently, such as hair loss or texture changes? When examining the hair, look for easily pluckable hair, hair loss, bald spots, corkscrew hair, or very fine hair. Next, look at the orbital or eye region for loss of subcutaneous fat. Use the index and middle finger to palpate under the eye, right above the cheekbone. Ask the patient if they have noticed any changes in vision or if they have trouble seeing at night. Look at the buccal or cheek region to examine for fat loss. Again, use your index and middle finger to palpate below the cheekbone. Examine the temple region for muscle wasting. Ask the patient to pretend chewing gum to engage the muscle. Palpate in a scooping motion over the muscle in a horizontal, vertical, and diagonal direction, looking for a hollowness in the temple. Another clue may be a prominent cheek or brow bone. Lastly, look at the mouth for signs of micronutrient deficiencies. Make sure to examine the lips, gums, teeth, and tongue for any abnormalities you may see. Ask the patient about any issues with dentition or swallowing. First, examine the clavicle region for muscle wasting. Make sure the patient is sitting upright in a bed or chair with the shoulders in a neutral position. Using the pads of your fingers, press along the clavicle bone, both above and below, to palpate for muscle tone or resistance. Determine if it is possible to push fingers under the clavicle bone, and if so, this is a sign of muscle loss. Next, palpate the neck using all fingers. Here, you are assessing for neck muscle loss. If there is muscle loss in the neck, it may feel squishy or gelatin-like. Move down to the shoulder region to assess for muscle wasting. If needed, assist the patient in sitting up with arms at the side to appropriately examine this region. By cupping your hands, feel and assess the muscle. It's important to look for squaring of the shoulder or a prominent acromion process. And lastly, examine the scapula region, another area for potential muscle wasting. Ask the patient to extend the arm forward. Have them press against your hand or the wall to help engage the muscles. You will palpate above, below, and around the scapula region. First, examine the upper arm region for fat loss. Assist the patient in bending the arm at a 90-degree angle. Grasp the arm between the armpit and elbow. Ask the patient to flex, if possible, to separate the muscle from fat. This will help in assessing the feel and space of fat between fingers. Next, palpate the side of the ribcage down to the iliac crest to assess fat loss. Pay attention to any depressions that you may feel between the ribs and a bony prominence of the iliac crest. Then, have the patient engage the hand muscle by pressing the index finger to the pad of the thumb. Palpate muscle near the metacarpal bone between the index finger and thumb. After examining for muscle loss, look at the nails for abnormalities indicating a deficiency. When examining the thigh, assist the patient with bending the leg to a 90-degree angle. The foot should be flexed to engage the muscles. Grasp the top of the thigh and palpate the inner and outer thigh to assess for muscle loss. Cup the hand to feel above, below, and around the kneecap. Keeping the foot flexed, grasp the calf region to assess the muscle. When assessing for edema, press on the bony top of the foot and continue up the inner bone of the leg. Be mindful that fluid accumulation can be painful to the patient. After completing the exam, let your patient know that you will discuss the findings with their healthcare team and thank them for their time, and then exit the room. Remember, as a dietitian, we cannot diagnose malnutrition. Performing a nutrition-focused physical exam is one aspect of how a dietitian can assess the health of a patient. This, along with lab work, a patient's history, signs and symptoms, and other information gathered from the healthcare team, can all be used to assess malnutrition.